Welcome and thank you for joining us for Episode 8, Essential Elements and Adaptation Guidance. I am Beth Malchus-Stafa and I am joining Debra Seltzer and Dr. Sandra Ortega in this CQI episode.
The topics we're talking about today, essential elements and adaptation guidance, will help you with ensuring that your PPPs meet the unique needs of your community while maximizing their effectiveness.
This guidance builds on everything you have done and will assist you as you move forward, continuously assessing your work and integrating feedback appropriately.
At the end of this episode, participants will be able to understand essential elements, identify what it means by adaptation, and will be able to access available resources that provide guidance on how to adapt and monitor your PPPs, using those essential elements as a guide.
This episode is a quick overview of these topics and will connect you to learning opportunities and resources for your use in identifying essential elements and working with program adaptation.
As we have discussed in previous episodes of this CQI series, all of your efforts should start with your needs, assets, and resource assessment, which becomes the basis for review of your existing PPPs or selection of new programs, policies, and/or practices, PPPs, for implementation in your community.
As you review your PPPs or move to select and implement new PPPs, you will be making decisions about whether you will be working with evidence-based or practice-based PPPs. Episode 3 is all about understanding evidence and describes the difference between these two kinds of evidence. It also provides guidance for what you need to have in place to document your use of practice-based evidence.
Sometimes, as you are considering a PPP for implementation in your community, you will realize there are some part of the PPPs or the implementation of that PPP that will not work in your community. The question becomes, what can you change without having to start over in building the evidence base for your PPP? What is the adaptation within the original context of your PPP? And when does what you are creating become so different? It actually becomes something new.
Other times, the need for adaptation comes up as you are beginning or in the middle of your implementation. You may find that you cannot get the time for an educational program that you had asked for, or your evaluation results may indicate that something is missing to achieve your outcomes.
Sandra, you make a good point. An important part of the CQI process includes looking at your evaluation results and figuring out what to do differently when your results are not what you expected.
Taking your evaluation seriously is critical to the process. We should not keep doing something that is not working. That wastes our time, your time, and resources.
Making adaptation isn't allowable within the RPE grant. You just need to follow the steps we will be talking about today. This episode will help you think about how to make your adaptation, whether it's at the beginning of your planning process or in the middle of your program implementation cycle.
Everything we will be talking about in this episode can be found in this online tool, which is part of the CDC Veto Violence resources. I really like this tool because it has the worksheets that we can easily use to jot down our ideas about our PPPs and share with others to get feedback on what we're thinking about adapting and why.
For each step we will be talking about in this episode, the Veto Violence website has worksheets that are available for download. These worksheets will walk you through the process of identifying essential elements, considering fit, and making appropriate adaptations.
Remember, the link in the slides are live and will take you to the resource, and we will include the resources in the handouts. Essential elements are the active ingredients, the what, how, and who of each program, policy, or practice, or otherwise known as the PPPs, which are identified as key elements needed for achieving the intent of the PPP outcome.
Once you identify PPP activities and desired outcomes, you can estimate the essential elements of that PPP. Estimating the essential elements will help you understand how a PPP is intended to work and the potential consequences of making changes to that essential element.
In the prevention strategy forms, which are the required mid-year reporting for CDC-funded programs, essential elements must be documented for practice-based strategies. Essential elements information is not collected for evidence-based strategies or policy efforts, as these essential elements of evidence-based prevention strategies are known as part of the evidence-based process.
Essential elements exist for both individual and community level practice-based PPPs, but they'll be a little different between the two. For the individual level practice-based PPP, the elements of what will describe the knowledge, skills, and messages delivered through the PPPs. For community level based PPPs, the element of what will describe the key messages, design elements, media, and policy components.
For the element of how, the individual level practice-based PPPs, the element of how will describe the instructional methods, delivery timing, and logistics. For the community level practice-based PPPs, the element of how will describe guiding principles, approaches, and processes central to the PPP success.
For the element of who, for individual level practice-based PPPs, the element of who will describe the person or entity delivering the PPP. For community level practice-based PPPs, the element of who will describe which leaders and partners are central to the success of the PPP. What are their characteristics, such as technical expertise, ability to sway opinions?
CDC has developed worksheets to help with the work to estimate what, how, and who of the different types of practice-based prevention strategy. For your reporting guidance, be sure to use the Word document titled Estimating Essential Elements of Practice-Based Strategies Worksheet, Word Final, which we will be distributing along with this episode. The Word document most closely parallels the RPE work. We encourage you to primarily use that for your guidance in identifying essential elements of your practice-based strategies.
In the Word document, there are sections for each type of PPP. Educational prevention strategy starting on page 1, creating protective environments starting on page 3, social marketing starting on page 9, and community mobilization starting on page 11. The document also includes, starting on page 6, a section on social norms. You may remember back in episode 2, Strategies, Approaches, and PPPs, we talked about the fact that we expect social norms change to be incorporated into all other strategies. Use these pages to consider essential elements related to social norms in each of your other strategies.
In this Word document, you will find that for each type of PPP, the following information is provided. Common essential elements with a variety of examples for that type of PPP, why these are essential elements for each suggested element, examples of what a more specific response would be for 1 or 2 sample PPPs. At the end of the examples is a blank page specific to that type of PPP. Education prevention strategy, creating protective environments, social marketing, and community mobilization, with guiding questions for you to use. Use these documents to prepare your responses to the essential elements for your practice-based strategies.
For all of the other worksheets we talked about in this episode, we'll be referring you to the Veto Violence website. But for this particular worksheet, try not to be confused by the examples provided on veto violence. They're not an exact match for RPE. We encourage you to use the Word document worksheet information instead. With that said, there are some additional examples that you might find helpful to look at. On the website, they use different headings: teaching skills instead of educational strategy, And on the website, they have combined social norms change with social marketing, but they do have some additional examples of social marketing in their social norms examples. So you may find that useful to take a look at after you've used the Word document for your primary worksheet-based work.
And Beth, isn't there another document that is also about essential elements and adaptation?
Yes, Sandra. An older resource was documented from CDC, issued in 2017, which is titled Using Essential Elements to Select, Adapt, and Evaluate Violence Prevention Approaches. That version has some basic examples of the worksheets, but does not have the same PPPs and does not have examples.
Thanks, Beth. We know that for the most part, you are already implementing specific PPPs. Ideally, you would think about fit before selecting a PPP. But even after you have started implementation, consideration of fit may help you identify needed adaptation. Where you are considering adding a new PPP, be sure to review the available guidance on assessing fit specific to that change.
We want to remind you that we are walking through the CQI process. As you walk through this process, you will see that a PPP you have implemented is not working. This is the time to consider whether you should adapt your existing PPP, or perhaps in some cases, you may choose to change completely to a different PPP.
The concept of fit is to consider the extent to which an approach's estimated essential elements can be supported in your community context, and to identify ways to increase fit by making changes or adaptations, if necessary, that support essential elements.
After you have completed a needs, assets, and resources assessment, or NARA, which we discussed in episodes 6 and 7 of this series, you should take a careful look at the PPPs you are implementing and consider their fit based on the new NARA results. Where there are gaps, there may be a need to make changes. A really easy example of where everyone needed to make changes was as a result of the pandemic. Essential delivery for most of our PPPs previously was in person and suddenly changed to virtual delivery as a result of the COVID-19 pandemic. Consideration for whether changing from in-person to virtual delivery was possible given the PPP and still expect to be within the established evidence base for that PPP became necessary. I'm sure you can all remember those hurried meetings and conversations when the COVID shut down our state.
An example we know many of you have experienced for essential content has been where the evidence-based strategy developed in a different part of the country uses examples that don't match with your community's culture or demographics. For example, there might be something about public transportation system, which a more rural community may not have. Does the content translate in some way, or is the difference such that a particular program just will not work in your community? A final example of essential implementer characteristics would be whether or not your program has the appropriate community relationships for the work that you're planning to do. For example, coaching boys into men relies on having coaches who are willing to participate in the necessary training and then implement the program with their athletic team. Having someone who is not a coach implementing the program will change the nature of the program. Implementation by a coach without the necessary training is also not acceptable, as it changes the essential element.
There is a specific worksheet available to use in considering fit, which is Worksheet 3, Assessing Fit for Programs and Community and Societal Approaches. This can be found on the Veto Violence website.
What you learn from consideration of fit is the extent to which a particular PPP, as it was created, is appropriate and feasible in your community. The next steps become a balancing of fidelity and flexibility. You need to maintain the essential elements you have identified while allowing for necessary adaptations. Adaptations are changes such as additions, deletions, modification, or reordering made before or during implementation to an existing policy, practice, or program.
Adaptations can be made to PPPs, but careful consideration must be given to how these adaptations are made, and your agency should be documenting and explaining such adaptations. There are now many resources available to help you think through this process, which we will be discussing and providing as resources at the end of this episode.
I know that many RPE programs have considered adaptation already, although they may not call them by that term.
What do you mean, Beth?
Many RPE folks working on the individual level PPPs have considered their community and the population that they work with. For instance, using safe dates. Many saw the scenarios as problematic. They changed the names of the characters and some of the situations to fit their community. Looking back, we should have been doing a better job at documenting our reasons.
Writing any of the changes, adaptations down, and sharing out among your peers and communities of practice might help others in similar situations. But I think I'm getting ahead of the episode.
You are right, Sandra. On this slide, we list some of the reasons and types of adaptation. We have a longer list on the prevention strategy form, which is used for the mid-year reporting. Please see your handout for more details.
Whether you are using an evidence-based or practice-based PPP, you always need to document and be able to report on any adaptations you make. You will need to describe in adequate detail what change was made to the design and implementation of the effort. What essential, what, how, and who is changed. How is it changed? For example, to implement a program in a different type of setting, what change did you make to the content or how it was delivered? Or who implemented it from how it was intended or designed? How does the change maintain the underlying logic of why the element is essential to the prevention strategy?
Using a traffic light framework can help easily describe whether an adaptation likely supports the essential elements of an approach or not. For example, an adaptation that is designed to emphasize a key message by extending the length of a discussion likely supports essential elements and is a good or green light adaptation. An adaptation that shortens or skips an important discussion without integrating it into a subsequent session is likely a poor or red light adaptation.
I like the traffic light framing because it offers opportunities to really reflect on the adaptations we're making with others on our team. It may not always be clear whether an adaptation is green or red. Some adaptations may seem more like a yellow light adaptation. In these cases, consider seeking input from fellow practitioners, technical assistance providers, or developers, and explore whether research evidence about the outcomes of a particular adaptation exists. Remember, when in doubt, give us a shout.
Tracking and evaluating adaptations involves documenting adaptations and assessing whether they support the essential elements and how they impact the approach outcomes. Tracking and evaluating adaptation is important because findings can be used to improve approach delivery or explain approach outcomes. Adaptations can be tracked and evaluated in both formal and informal ways.
Informal tracking methods can include meetings with approach leaders, partners, and recipients to learn more about the reasons for and real-time impacts of adaptations. CDC has developed a worksheet which can be used to highlight and reflect on immediate challenges, successes, and areas for improvement related to adaptations.
Formal evaluation typically happens at multiple points in time during approach implementation and includes systematic collection, analysis, and interpretation of adaptation data. Formal evaluations can include conducting focus groups, interviews, and surveys with approach leaders, partners, and recipients to learn more about the reasons for and impacts of adaptations. Adaptations can also be systematically evaluated by conducting observations and asking implementers to self-report on adaptations made during sessions. This tracking and evaluation that you reflect on continues to be part of your CQI process. Whether the results show your program is working or it's not working are all good and can go into lessons learned to share in our communities of practice.
Remember, for each step in this episode, the Veto Violence website has worksheets that are available for download. These worksheets will walk you through the process of identifying essential elements, considering fit, and making appropriate adaptations.
There are also 3 Prevent Connect webinars that go into more depth about these topics and provide examples of essential elements and adaptations using specific program examples. The webinars are listed here and can also be found in your handout.
Thank you for joining us today for episode 8, Essential Elements and Adaptation Guidance. Remember, we are here to support you, so just reach out to any of us if you want individual TA or just want to bounce an idea off of us.
A special thank you to Jasmine Barfield for her techie and vlogger expertise. The results of working with her has advanced our work forward by using a different learning platform. We are very grateful. Finally, a program about CQI wouldn't be complete if I didn't ask you to fill out an evaluation following this episode. Your input will help us with future episodes and identify if we need additional resources to share with you.